Are you a breastfeeding mother wondering if it is safe to take ibuprofen? In this video, I am going to discuss the safety of taking ibuprofen while breastfeeding and provide some tips on how to make sure that your baby is safe. 1. Is it safe to take ibuprofen while breastfeeding? The answer to this question is not a simple yes or no. Ibuprofen, like other commonly used medications, can be passed through breast milk in varying amounts. However, the levels of ibuprofen that are transferred through breast milk are usually well below those considered safe for adults and infants. Generally speaking, ibuprofen is considered to be a safe medication for breastfeeding mothers when taken as recommended by a doctor. 2. What potential risks should I be aware of if I take ibuprofen while breastfeeding? It is generally accepted that ibuprofen is safe to take while breastfeeding. However, there are some potential risks you should be aware of. Ibuprofen can increase your baby's risk of developing gastrointestinal problems, such as irritation and bleeding in the stomach, especially if taken often or for a long period of time. Additionally, ibuprofen may also reduce the amount of breast milk produced in some women. Therefore, it is important to discuss any concerns with your healthcare provider before taking ibuprofen while breastfeeding. Additionally, moms should always be sure to follow the instructions on the medication label regarding dosage and frequency. 3. Are there any other medications I should avoid while breastfeeding? Yes, there are other medications you should avoid while breastfeeding. These include certain antibiotics such as sulfa drugs and chloramphenicol, tranquilizers or sedatives, and bronchodilators, medications used to treat asthma. Additionally, some herbs may decrease milk supply or have other effects on the nursing infant. If you are considering taking any medication, herbal supplement, or over-the-counter product while breastfeeding, it is recommended that you speak to your doctor for more information before doing so. It is important to remember that even small amounts of a drug can pass through breast milk and affect the baby's health, so always talk to your doctor first. 4. How can I minimize the risk of taking ibuprofen while breastfeeding? If you absolutely must take ibuprofen while breastfeeding, there are a few steps that you can take to minimize the risk. Take ibuprofen with food. This will decrease the amount of drug that is absorbed in your body. Take ibuprofen at bedtime or shortly before breastfeeding. This limits how much of the medication will be passed along to your baby through breast milk. Spread out doses as far apart as possible. For instance, if taking 600 milligrams 3 times a day, space those doses 7 hours apart with no dose within 4 hours of nursing. Avoid taking more than 800 milligrams of ibuprofen at one time and, if possible, no more than 1,200 milligrams per day. If you experience any side effects or are concerned about the amount of ibuprofen in your breast milk, contact a healthcare professional immediately. A doctor can help you determine what is safest for both you and your baby. It's important to remember that when taken appropriately and as directed, ibuprofen can be an effective way to reduce pain and inflammation while breastfeeding. However, use caution when taking it and always consult with a healthcare professional before doing so. Taking ibuprofen responsibly while nursing can give you the relief that you need without risking harm to your baby. 5. How much ibuprofen can I safely take while breastfeeding? In general, the recommended limit for ibuprofen while breastfeeding is no more than 2,400 milligrams per day. This amount should be taken at regular intervals with food and plenty of fluids to avoid irritation to your stomach. It's important to talk with your healthcare provider before taking any medication while breastfeeding, even over-the-counter medications like ibuprofen. Your doctor can help you determine the best dosage and type of ibuprofen that's safest for you and your baby. 6. Are there any other side effects that I should be aware of when taking ibuprofen while breastfeeding? It is important to note that ibuprofen use while breastfeeding may cause an increased risk of certain side effects, including gastric ulcers, nausea, vomiting, and diarrhea. Additionally, ibuprofen use can also lead to a decrease in milk production or the quality of breast milk. If any of these side effects occur after taking ibuprofen while breastfeeding, it is important to seek medical advice from a healthcare professional immediately. It is also important for mothers to be aware that using ibuprofen long-term could affect their fertility, as well as harm the health of their baby. To reduce potential risks associated with ibuprofen use while breastfeeding, it is best to limit its usage to only when absolutely necessary and at the lowest recommended dose. 7. Are there any natural alternatives to ibuprofen that I can take while breastfeeding? Yes. There are a variety of natural alternatives to ibuprofen that you can take while breastfeeding. Some popular options include ginger, turmeric, tart cherry juice, omega-3 fatty acids from fish oil supplements, and magnesium sulfate baths. Each alternative has its own unique benefits and should be discussed with your healthcare provider before taking them. Additionally, it is important to note that natural treatments may not work as quickly as traditional medications like ibuprofen, but could still be effective in reducing pain or inflammation over time. Furthermore, the American Academy of Pediatrics recommends avoiding the use of over-the-counter products containing aspirin or any combination of drugs without consulting your doctor first due to potential risks associated with their use while breastfeeding. In conclusion, it is generally safe for breastfeeding moms to take ibuprofen as long as they follow their doctor's advice. It may be necessary in some cases, but always check with your healthcare provider first before taking any medication while nursing. Thanks so much for watching, and if you have questions or comments about this topic, please leave them below. Don't forget to like, comment, and subscribe. We'll see you next time.